Everyday Health is one of the largest providers of news and information in the health and wellness media space. This is something which the company has focused on. We have some of the best journalists, the largest numbers of journalists in this particular community, and we have really been focusing on how do we improve a product which is already pretty darn good. And we've looked at increasing content and increasing products, and we've done all of that, but we're also looking for different voices. We're looking for people who bring a powerful sense of the professional community and consumers, who can talk to professionals, who can talk to consumers, put things into context, put things into perspective, as it were. And we settled on Dr. Sanjay Gupta and have spent some time talking to him, getting him to understand who we are and what we're all about and what our vision is. Because I think what really attracted Dr. Gupta to us was our vision. And our vision is to be the finest, largest health and wellness provider of news and information in the media space. Our mission is to do good. Our mission is to do good for our users. And who's better than Dr. Sanjay Gupta to contextualize, to give that level of perspective, that insight, that both consumers and professionals crave. Dr. Gupta is going to be working for all of our sites, but in particular he's going to work for MedPage Today, which is our site which is directed towards healthcare professionals. And by that I mean doctors and registered nurses and people who professionally pursue a career in healthcare. He'll do a lot of video for us. He will also do a lot of written stories for MedPage and everydayhealth.com. We're creating an app for professionals just around his content and content that he creates. And you know, we'll see as we go forward. I mean, you never know until you've actually started a relationship where that relationship will end. The primary thing we're doing, whether it's video, whether it's text, but the primary thing we're doing with video is we are trying to do good with it. We are trying to give people actionable information around subjects which is of great importance to them. Video is very spiky. What works and what doesn't work is very hard to put your finger on. I can tell you though that back in February, I guess just a year ago, we had no video at all on our sites. By June, we were doing 12 million video views. We'd ramped that up to 20 million video views before we started scaling back just to make sure that we were producing the right kind of video. It was getting consumed in great quantities. It seemed to have tremendous, it was tremendously successful amongst our users. Just yesterday, we had close to 1 million video views on a variety of different stories. Sometimes they're very topical, sometimes they're very condition specific. The one thing we are noticing in video is very high engagement, particularly when it gets to specific condition areas. So if somebody comes into our diabetes section and they watch a video, they'll then watch 8. So they were consuming the video to the end. And that's not something you notice around more general interest videos. We are producing videos in-house. We have a terrific reporter who used to work on Good Morning America is our correspondent. We have a whole video team. We build our own studio. We do about 6 stories a day, Monday through Friday. And that's on the consumer side. On the professional side, we don't do quite as much, but we also produce video specifically for professionals as well. For a variety of reasons, we haven't syndicated our video really. I mean, we have a couple small relationships around syndication. We're trying to keep the videos until we really understand what users want. We're trying to keep them on our sites because it's easier for us to do the analytics, get the feedback, and continue to hone the quality, the amount, etc. We'll definitely move into a more aggressive syndication strategy, but as of now, we really wanted to take the time to get it right before we start pushing it out into the marketplace. Video is terrifically important to consumers, and we strive to give consumers, whether they are professionals or whether they are, the mother of 2 sitting in Tulsa, we strive to give them what it is that they want, where they want, when they want. And the market has spoken. People like video. Not for everything, but they like video. So providing more video is critically important to us. Getting our video numbers up is important to us, but as long as it's serving the needs of our users. There's no reason to just jam video views if our users don't really care about it. They're just kind of watching it. It's not that important to us. I go back to what the overall mission of the company is. It's to do good for people in the health and wellness space. If we're producing good videos that we're proud of, that serve the needs of our users, we'll produce them till the cows come home. That's what we're all about.